Welcome back. Some of that $2+ million in grant money will be given to the Milwaukee County Family Drug Treatment Court.
And over the next 5 years, they'll use that money to enhance their treatment services. So joining us today is presiding Chief Judge Maxine White to explain how this program works, how this money will be used. Thank you for joining us.
Thank you for having us. It's a wonderful time at the court. You can imagine with another $2.1 million, but essentially our Family Drug Treatment Court was started in May of 2011. So we've been in business over 6 years. We've been in the business of therapeutic courts for adults for quite a while, but the children's court aspect of it, worrying about what happens to babies and children who have parents who are substance addicted, has been a great concern of ours. So in 2011, we started this effort to bring in participants who had been faced with child abuse or neglect. So instead of criminalizing their behavior of not taking care of the kids, we sort of put that on hold, bring them before a different judge who then works with them on a recovery effort. It's a voluntary program where a parent can agree that they will participate. The entire family participates along with the participant. I've sat in the court where the judge presides. There is a wraparound program with about 8 other agencies participating and providing services. But just as everyone knows, it's a long journey back. In the old days, we would have taken the child away from the substance addicted mom, even a newborn, and put it in a program where we would look for foster parents or adopted parents. But under these circumstances, a parent can work themselves back out of the abusive neglect allegation through recovery to regain the child.
So what type of treatment are you offering? What do these courts do? And is it working?
We have evaluated ourselves. We've had others evaluate us, and it's working so well that the first court, our court, is now on track to be emulated at other sites throughout the state and the nation. They do work. It costs money, it costs time, and it costs a new way of looking at the problem as a public health problem.
We're talking all sorts of drugs.
Also,
but opioid,
heroin,
right.
Opioids, crack, the whole gamut.
And has there been this sort of transformational moment here that not lock everyone up, but find a way to lock them into a treatment program?
Absolutely. And I think that as a nation, we've always known that a lot of behavior is driven by either mental challenges or a combination of that plus substance abuse addiction to really hard drugs that no one on a single path can recover from on their own. So what we've learned in the criminal justice system is that we can't lock our way out of this. We have to engage other models of dealing with families to render them healthy.
I want to ask though, when did that pendulum shift? Because many argue that the same epidemic for crack was happening in the 80s in minority communities, and there was not this sense of looking at the person as a victim, but looking at them more as a criminal. And now we have heroin, we have pain pills, and we're seeing these people who are doing the same acts that people were doing in the 80s and the 90s being saw different.
You're absolutely correct. And a lot of us, the citizenry as well as governmental officials, prosecutors, I was a federal prosecutor in the 90s at the U.S. Attorney's Office here, and I had parents who would say to me, even at that time, I would do anything to get another hit of crack, that it has rearranged my brain, my method of thinking, and we've grown a lot as a nation. We were wrong, and it doesn't mean that we cannot learn from those horrible mistakes. We have other programs that try to address that wrong. We have another grant from another foundation that talks about looking at people who come in the front door now to see if they're suffering from mental health or substance addiction. And we have programs such as, and I hope I get a chance to talk about them at a different date, post-booking stabilization. Behavioral health, the DA, the public defender, the judge will look at a person who's arrested because a family member called us and said they're out of whack. We don't know what's going on, we need help. What they mean is we need recovery help. And so in those circumstances, what we're doing now is evaluating at the front door of the criminal justice system to see, is this the right place? And in 44% of the cases, it's not the right place.
Well, you're right. We're going to have you back to talk more about this because it is an important topic, and we just probably got through the front door on this one. All right, thank you.
Thank you.
Coming up on 411 Forward, what you can do to fight the opioid crisis right now.
Take a look at the unused prescribed meds in your medicine cabinet during this commercial break, and we'll come back to tell you what you can do with them.